Colon cancer is the second deadliest cancer among adults, and now new groundbreaking technology at AU Health is helping doctors better detect it. News Channel 6's Darrenisa Jefferson explains.
With the help of artificial intelligence, this small piece of technology is making a big change in how doctors at AU Health can help detect colon cancer.
It just picks up something that shouldn't be on the surface.
An artificial intelligence software is helping AU Health and the Georgia Cancer Center better find the polyps that can lead to colon cancer.
It will show up a green box indicating, hey, stop, look at that area, there's something not normal there.
AU Health is the first in the state to offer the technology that gives doctors a second set of eyes and helps to pinpoint polyps that could be missed during a colonoscopy.
The less we miss the polyps, the better for the patient, because those are the polyps that can eventually become cancer.
Chief of Gastroenterology Dr. Kenneth Vega says a typical colonoscopy can miss between 5 and 8% of the polyps, leading to colon cancer.
And those people that don't have polyps found initially may have them develop and become larger when they have their next examination.
He says the new AI technology will cut down on missed polyps and increase early detection.
There is literature that shows that about 15% of patients coming in for screening colonoscopy would have polyps found by this technology that would have been missed otherwise.
Doctors say that early detection can be crucial in getting ahead of colon cancer before it's too late.
Too late meaning that it might have spread and we cannot do anything surgically or endoscopically. So preventing that to happen, seeing more of these polyps with the help of artificial intelligence is very important.
The CDC recommends colon cancer screening for anyone ages 45 through 75. In Augusta, Darrenisa Jefferson, WJBF, News Channel 6.